Pinch nerve in your elbow is the subject of this video. Hi, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. Stay tuned. All right, so you have this pain in your elbow. You call it pinch nerve in your elbow. You may call it tennis elbow. You may call it golfer's elbow, whatever elbow you want to call it. Let's discuss that. Can you have a problem in your elbow and just isolate it to the elbow? The answer is never. Unless someone just whacked you in the elbow right there and then, and that caused your pain, all the other elbow issues you have are never isolated to the elbow. So I've done a whole blog on this. I invite you to read more about it. When we're talking about the elbow joint, it's actually 3 bones. So if you didn't have a trauma, so you may have played tennis or played golf and you ended up with it, but the one time is not going to do it over time. You may have it, but then later on it goes away, so it's out of your mind. And then the next time you play that sport, you feel it again. And then over time, you're like, oh, geez, this thing is really hurting, man, even though I'm not playing tennis or golf. You have to understand this was a sign of a dysfunction. There are nerves that go through, you know that. You know, that funny elbow that we talk about, that's your ulnar nerve that gets impacted and you bang it against something, you feel that pain. But almost all of them are not necessarily nerve pinch. There is a dysfunction in the joint itself. So if you're typing away most of the day, as an example, and your keyboard, just the size of your keyboard, something simple as that, forces your elbows to be closer to your body as you're typing away. Not every head of your triceps, which has 3 heads, gets involved, gets practice. One part, but certain parts of your arm muscles get overworked while the other ones never even get a chance to talk. So what ends up happening is you're creating an imbalance in the musculature of your forearm, as an example, or the musculature in your arm, your biceps and your triceps. And as a result of that, you end up with dysfunction and imbalance in performance of your shoulder joint muscles, like your deltoid, as an example, your upper trap, all of those, infraspinatus, all the rotator cuff muscles, all of those. So they become the feeders of your elbow problem. So the elbow becomes dysfunctional because the surrounding areas are not performing well. So then what is the answer? How do I fix it? You take away the activities that create an imbalance in you. So you can't quit your job, but you can modify what you're doing, how you're doing it. You become a smarter version of you as the worker. So you take away that activity, you implement exercises, not in isolation. You implement exercises that work all of these areas. So that's your wrist, your elbow, your shoulder, your scapula, and your neck. All of those working together to perform as the rest of your body learns how to stabilize itself. So let's say your body weight, as you're pushing up, your body weight does not become a burden on these joints and their lack of performance. We're not talking about push-ups here. We're not talking about pull-ups here. There are a lot of preliminary work that have to take place to assure what needs to be there is there. So I'm not saying go ahead and start doing pull-ups, because chances are you will not be doing your pull-ups correctly. Your form is compromised. The moment your form is compromised, you're creating issues. You're putting yourself up for a disaster. So we're gonna put a video on what is developmental kinesiology at the end of this video. And I invite you to visit my website to read more about it. Make sure you subscribe to my channel, and if you have any questions, contact me using one of the methods of contact in the description box. Thanks for watching.